All right, it's back to school season here in Connecticut, and especially with COVID restrictions still impacting our daily day-to-day lives, that could be a source of added stress for young students across the state.
Joining us today is Dr. Rhonda Randall, the Chief Medical Officer at United Healthcare. She has some tips for supporting your children's mental health and their emotional well-being. Thank you so much for being with us, Doctor.
Thank you for having us.
All right, well, there's no doubt the COVID-19 pandemic has had an impact on the stress levels of our students, correct?
It's true. The pandemic has had an effect on almost everyone, but you're right, it has disproportionately affected children and teenagers. In fact, research done shows that high school students say that their emotional well-being is worse today than it was in March of 2020. And when parents responded for elementary school age children, it was 1 in 5 that say it's taken a toll.
Wow.
I mean, all the uncertainty, or for teens, you know, they so have the need to be with their friends, they weren't able to do that. But what's your advice now, as hopefully the world is going back a little bit more normal, kids are going to be in full time. So how do we take care of them now that some of the things that they missed are coming back?
I think it's really important to keep a close eye and really pay attention on some of those subtle things and intervene early and get that support. One of the best ways to support your children is to share information, encourage open communication, partner with your school. Many schools have added additional resources in your communities. And of course, teachers, pediatricians, and your family doctor are also important in all of this, and helping children feel secure. As we go back to school around the country, the pandemic is hitting us at different points in time. So really paying attention to what's happening, limiting some of that stress around the news, and creating normal routines as much as possible. So things like a routine bedtime, the importance of a family dinner whenever that's possible, sitting down together.
Yeah, that's absolutely important for more reasons than one, right? All right, one of the most difficult aspects of the COVID-19 pandemic is how hard it's been to focus on virtually anything else. Is that an issue for students?
It sure is. And, you know, they don't need to be in the 24/7 COVID news cycle. So, you know, the updates on what's happening in your community generally are not happening moment to moment. So having a good awareness of the risk, but that doesn't need to be constant. And the routine that we talked about earlier, that bedtime, that family time, but also healthy activities, sports, getting back to those things are coming back this year. That's great. Hobbies and other things that interest your child. That piece around connectedness, social and emotional well-being are as important as in schools as academic learning.
You know, you say it's important that we sometimes have to pay attention to more than just the words of kids. As parents, we have to be a little bit like detectives. What should we be looking for?
What you're looking for in particular is when that stress moves from something that causes us to be productive to when that stress starts to really affect our emotional health. So you're looking for signs of anxiety, signs of depression, and in kids that can be things like changes in their academic performance. It could be changes in their sleep or eating habits. And so really thinking about where you can get those additional supports and resources from people who are trained to do those assessments, pick up on those things early and intervene. The other thing that we need to pay attention to is suicide rates in our nation, particularly in adolescents, have been increasing prior to the pandemic. So making sure that we're paying attention and seeking professional support when it does become more serious.
You say the most important thing we can do is listen and watch for our children, correct?
It is. And if you have concerns, talk to a professional right away. In fact, the person I recommend you reach out to is your pediatrician or your family doctor. That's a great place to start. They have a long-standing relationship with your child in most cases and can see along with you the changes and concerns that you may be picking up on.
Okay.
Yeah, and just one more question, while we have you, if you have increased stress levels in children, I think as adults, you know, we know what that looks like. We're stressed, but in kids, it comes out in different ways. How does it affect them?
You know, again, it may be changes in their academic performance. It may be changes in their mood or withdrawal, things that they used to really be interested in. They may lose interest in, maybe changes in their appetite, changes in their sleep habits. So again, those schedules and those routines, turning the connected devices off at a routine time every day, All of those things important to pick up on. And there's support out there. Your employer may have an employee assistance program. Your school might have added a counselor specific for mental health around children if they didn't have it before, since the pandemic started. Again, your pediatrician or family doctor are a really good place to start. And there's more and more apps available for things like stress. One I like is called Sanvello. So it has meditation and other modules that it can take you through to give you that self-help support.
Okay, just let your kids know that you're there for them and that they can talk to you. I think that's really a home run.
Right. And then maybe you've been through it too, right? All adults have handled stress. So acknowledging that stress is a normal part of life, that you feel it too, and some tips of how you might handle it.
Okay, cool. Well, thank you so much.
Thank you. For more
Thank you.
information, you can visit uhc.com or follow them on social media at UHC. Maybe sit down and just watch that interview with your teen
Absolutely.
and talk about it.
Good idea.